Welcome back to Get Connected. I'm your host, Conn Jackson. We're here in Puerto Vallarta for an awesome show. But we need to save money. And a big way to save money is on your health insurance. No better person to talk to than Carrie McLean that joins us now for our Health Beat segment. Carrie, welcome to Get Connected.
Hi, Conn.
Well, Carrie, Happy New Year to you, but I've got to ask, what led you to become a consumer health insurance expert?
I keep asking myself that. It's so confusing. I don't know. I have too much information about health insurance, I think.
Well, Carrie, with that info, what did you just learn from the survey about the cost of insurance if we don't follow through on our New Year's resolutions?
There's a big cost associated with keeping your resolutions of quitting smoking and losing weight. When you go to apply for health insurance, you are going to be asked if you smoke and how long, if you've smoked within the last 12 months, and then your height and weight. And that can add up to a lot of dollars in your monthly premium. So eHealth Insurance did a survey and found that women are going to pay about an extra 23% more in their monthly premiums if they smoke, and men are going to pay about 13% more. So those costs can add up, not just to mention the cigarettes, but in your monthly premiums. That's a big jump.
Very interesting, Carrie. Now, I'm also curious, there was another study done by Towers Watson. What surprised you in the results of that survey?
I think what we found that surprised us was that employers are now finding penalties and fees that they may charge you if you're a smoker or if you're obese, because those factors can increase the overall group's rate. And so we're finding that employers are starting those trends, so it's even more incentive to get some more healthier habits.
Well, Carrie, I've got to ask, what impresses you most about eHealth Insurance?
Wow, that's an interesting question. So I think what impresses me most is that we are the largest online broker. We do business with 180 different carriers in every state. That's huge. There's nobody out there that's doing that can give you the most options when you're searching for health insurance. The other thing that impresses me is that we really want to make sure that people are smart shoppers. So what we've done is we've created this Health Insurance for Dummies book that you can download for free on our website and get lots of information about how to purchase health insurance and what you need to know when you're going through that journey.
Well, speaking of the journey, Carrie, I'm just curious, what are about 3 things that we should consider in picking the right health insurance for ourselves?
I think the 3 key things is, 1, know what's in your budget and how much you can afford to pay for your health insurance. The other key thing is know what you want to get out of your insurance. Do you go to the doctor a lot, or do you hardly ever go? Because maybe an HSA plan would be work for you because you don't use a lot of doctor visits and you can save in your monthly premium by doing that. The other thing is, if you really like your doctor and you want to stay with your doctor, make sure he's in the network, in the provider that you choose. Lastly, work with an agent. It doesn't cost you anything extra to talk to an agent. It's very confusing, and so you may not have all the right questions, and they can help you through that process to make sure you're picking the right plan.
And Carrie, on the opposite side, what do you see as the biggest mistakes we make when selecting our health insurance?
The biggest mistake I see is that they look at price only. They don't even look at the benefits that they're getting, and so they may be purchasing a plan that is very low cost, and they're not realizing that doctor visits aren't covered, prescription drugs aren't covered, and there's specific things in those plans that can be excluded. They need to make sure they're looking at the benefits, not just that low cost.
Carrie, great insight on that. Now, when it comes to HMO versus PPO, which one is right for which person?
So it really depends on your preference. And what we found is that if you tend to go to the doctor a lot, maybe an HMO is better for you because HMOs typically have unlimited doctor visits. And so you can go to the doctor as many times as you want and pay a low copay, versus a PPO you might find where you have to limit the amount of doctor visits, not as much. There's flexibility in which doctors you can go to, but it depends on your preference. And some people just like HMOs versus PPOs and vice versa.
Carrie, you're very helpful. Now let me turn back to the booklet you mentioned earlier. How can we best use it and what will we learn in there?
So how to best use the booklet is go through it, and there's sections in there that talk about healthcare reform and understanding what that means and when things are going to be changing and how they're changing. This whole process of healthcare reform has been very confusing. So this book really helps you to break it down. It tells you how to be a smart shopper and find the right plan, as well as describes how what the terms are, deductibles and copays and coinsurance. Those things can get very confusing.
Carrie, you've been great. Let's sum it up. Where can we go to learn more information on selecting health insurance?
So there's more information at ehealthinsurance.com, and like I said, you can get that book for free.
Well, Happy New Year, Carrie. Thanks for joining us. Thanks for the great insight.
Happy New Year. Thanks, Conn.
If you want to learn other Health Beat segments we've recently done, please log on to our Get Connected website at conntv.com. We'll be right back here in Puerto Vallarta when the little sea turtles are headed to the ocean. Thank you so much for watching. Are you tired of negative news? We are.
And that's why we're creating a movement.
By keeping it real.
With what you need to know.
It's more than what's happening.
It's bringing hope back to our lives.
So go to conntv.com and join our movement.